Hi, everyone. It's a real treat today to introduce you to my friend, Dr. Melanie Adrian, an associate professor in the Department of Law and Legal Studies, who holds the inaugural chair of teaching innovation at Carleton University. Dr. Adrian writes and speaks about human rights, integration, minority religious communities, Islam in particular, and religious freedom. If you're interested in these themes, I really encourage you to read her published works, including her excellent book, which I'll link to the website. But today we'll be talking about something completely different, Dr. Adrian's personal journey with cancer. After being diagnosed with breast cancer, Dr. Adrian founded Be the Choice, an organization revolutionizing decision-making for breast cancer patients, which I've also linked to the website and encourage you to visit. For this and other amazing community work, Dr. Adrian was named to the Order of Ontario in 2019. Dr. Adrian, thank you so much for joining our virtual class today.
Thank you so much for having me, Dr. McLaughlin. This is such an honor to be here with you.
I feel the same. And before the pandemic and before online learning, you often visited my class in person. So it's really neat to have you join us in this way.
Yeah, love it. I think it's a great idea. And I wish I could be there in person also to meet the students. But I hope at least this way we can reach everyone.
Absolutely. And it's a lot faster than driving from Ottawa.
Yes, that's true too.
So I was wondering if we could start off by just telling us a little bit about your personal journey with cancer.
So I had actually just moved to Canada in 2010 and didn't have a family doctor. And so when I went to see my family doctor early in January 2011, she had just literally graduated from med school and was very careful about taking on new patients and new tests. And so she said, let's do a complete physical. And I remember so clearly her saying, let's also do a mammogram. And I said, a mammogram? I'm in my 30s. Why would we want to do a mammogram? And she said, you know what? It's just good to have a baseline. You've just moved back to the country and you don't have medical records. Let's just get this established. That decision changed the course of my life because she caught it. She caught it. And so I had a mammogram, which showed that I had what they thought were calcifications at first, but then turned out to be an over 5 centimeter tumor that was locally advanced, meaning it had already moved into my lymph nodes and my lymphatic system.
Wow.
So
you had no idea.
No idea. Nobody could ever feel it.
Wow.
Because then it was my mission to go to different doctors and say, can you feel it? They're like, no. So yeah, so couldn't feel it at all. And so really imaging, what they call imaging, ultrasounds, MRIs, mammograms, really saved my life. Yeah. So
that's really young to be offered that. And we'll talk about this later about why people are not being offered imaging until they're older. But was there a particular reason your family doctor thought to do this? Is it just because you were new, or was it something about family history?
So
really unusual. I've never heard of that happening at that age.
Yeah, my mom had been diagnosed and had breast cancer in her 50s. And so for her, it was that combination of family history and then the fact that I didn't have any medical records. So she just really wanted to get a baseline of everything. And, you know, and at the time I just thought, I said to her, I was training for like a surfing competition at the time. I was like, I am so healthy. I don't need a mammogram. Right. And here we are.
Wow.
So yeah, that was shocking news. And even though my mama had it, but nobody else in my family had ever had it. And we didn't have, you know, a genetic association with it. And so, yeah, it was pretty shocking. But what I've realized is that, you know, there are many more young women who are diagnosed, unfortunately. And, you know, age, it's true that it's a disease that is still older, right, in terms of its diagnosis and treatment, but it's creeping down. And so we want to be aware of that, right? And we want to change our policies, you know, to reflect what's happening. So
Yes, and we'll get into that in a moment. Is there anything else you want to add just about your journey after that shock of that being like, what was it like to just be told at that young age
Yeah.
that you actually had this tumor?
Well, it's shocking because, you know, many people associate breast cancer with death, right? This is not a survivable disease. I'm not going to be able to outlive this. I can't believe I'm 30, you know, I was 36, 37 at the time. Can't believe I'm, you know, I'm at this stage. But so there's that shock, right? And then that shock reverberates throughout your family and friends, right? And everybody, you know, has to take that in. But for me, my trajectory was a bit different because I then was sent to the, you know, breast health center to figure out what's next. And so I went to see 3 different surgeons who all said to me, I just had to have my breast removed. Or as one surgeon famously said to me, we just have to lop that off. I didn't want to accept that. One, because I couldn't believe that we had been running and walking for the cure for so many years, and that my decision that was the same as my mother's decision 10 years before, that was either take the breast off or die, basically. Those are the decisions, right? And I was like, haven't we come further than this? I mean, haven't we been able to leverage some of these funds that we've raised to help create new decisions for people in my position? And so I said no to all of those doctors. I said, I will not do this surgery. I want to know that this is the only thing that can be done. And so I reached out to my network, and I was lucky that I had the time. I had the ability to not be too anxious about not going ahead with surgery immediately. And then I had an extended network of people that I connected with to help me think through what some of the other options might be that are out there. And I didn't know there were any other options at the time, but I wanted to figure out for sure that this was the path I wanted to take. And so I had to exclude other options from that horizon. And so, but it turns out that, you know, within 48 hours of me sending out this big email to friends and family who had connections in the medical sphere, particular breast cancer labs and so on, I had an appointment with a doctor from the US, actually, who is a world-renowned breast surgeon. And I got on a Skype call. This is pre-Zoom. Got on a Skype call with him, and the first thing, yeah, the first thing he said to me was, "Why are you still taking breasts off up there in Canada?" Right? And I said, "What?" So that was the second shock, right? Because, you know, I'd had this diagnosis, and then I'd had all this advice from top-notch surgeons, right? Or what I thought were top-notch surgeons. And I'm being faced with the fact that they're not top-notch, actually. And so that was another big shock for me, but also a gift, because he gave me the language of the alternative treatments in this field, which is the breast conserving or skin sparing mastectomy. And that is when skin sparing mastectomies are unfortunately, they call them the same thing as kind of the old, more standard procedure, which is when you take off, you know, the entire breast, including the skin and the areola and the nipple and so on, right? But actually, the areola and the nipple and the skin are not diseased, right? It's the tissue that's diseased, or can be, or parts of the tissue. And so there are actually very advanced surgeries that have less scarring, are less invasive in some ways, and kind of put you back together quickly, that have been tried and proven in clinical practice for over 20 years. And that was not offered to me by the first 3 surgeons that I saw. Now I have to say, this was in Ottawa, and the Ottawa program has changed dramatically since that time, because of, I think, partially be the choices intervention in that conversation. But that's for a little later. But so I, with that language, armed with that language, I then found a fantastic team of surgeons. Again, using my networks and getting out there and talking to people about which of the surgeons in this country performs these types of surgeries. And I found a fantastic team in Hamilton at the Juravinsky Cancer Center. And I went to them, and that's who treated me. So
So this story really shows the importance of advocacy in health decision making, because had you not been so resourceful and tenacious, you would have ended up just following the path that was originally suggested to you. And instead, this completely changed your trajectory.
Yeah, absolutely. And it not only that, I think, and I realized, listen, I was in a very privileged position, right? Because of my personality, I'm feisty and I didn't want to accept it. And also, I had the time, I didn't have young children at the time. I didn't, have other kind of conflicting, things going on in my life. I could focus on this for that moment. And, most people don't. Most patients, go into doctors and have a perspective of, one, trusting the doctor, and we should trust our doctors, right? But we should also know that they're humans and that they'll offer us what's in their toolkit, not what is possible potentially, right? So now I think that's a failing on behalf of the medical system. The medical system, i.e. the doctors and the medical teams that we see that are the frontline people for us, they should be offering us what is possible, not as what is doable in that context. And, so they should refer out. So, I don't do this surgery, but there are these other surgeries that can be done, right? But that didn't happen at the time here in Ottawa. And, but it goes to show that it's important to, arm yourself with information and then to really seek out what's going to be best for you, because the patient always knows what's best for them. The doctors don't know what's best for you because they don't have the big horizon on you and your life, right? So it's really, really important to and of course trust them, but also do your own homework.
Absolutely. So this experience led you into a journey of not just advocacy for yourself, but advocacy for everyone, all of those future patients to come who may not have the privileges and the advantages you had with your education and the time you had available and the things you just mentioned. So tell me about how your journey transitioned into what became Be the Choice.
Yeah, so so it turns out I had to have every treatment pretty much, right? So I just, I went through I had surgeries and reconstructions and radiation and chemo, everything. And, and I was literally in every support group you could imagine, because I was like, I have breast cancer, I need support. I need support. I need to talk to people about what's going on that are going through this. And, and the more I sat in hospital waiting rooms and support groups and, met with others that were going through this, I realized how privileged and lucky I had been, because I had a surgery that, entailed much less scarring. I recovered from relatively quickly. It allowed me to get my radiation and chemo and everything out of the way quickly. There were all these positives. I was never without breasts, which for me was a part of who I am and my identity. And, I was darned if I did not want to be the one boobed surfer, right? I was like, the woman with the arm that's off, she's got that title. I do not want the other one, like not going to happen. So, but what I realized is that most people, in fact, everyone that I met, hadn't had that opportunity. And that made me both really sad and really angry. And so when I met, especially young women who, had been through all the treatments, had potentially both of their breasts removed, but had this like dream of having a family, for example. And then they come out the other side, they're 5 years cancer free. And then they go to their oncologist and say, I really want to have a baby now. And the oncologist says, did we forget to mention you're not going to be able to do that? Right? And the devastation of that moment is it's incredibly powerful in a very sad way. And it really fueled my desire to do something about this, to inform people, to give them the opportunity to make decisions that aren't just for this moment, but also for the long term.
So in that example you just gave, what kind of information could they have had that might have helped to change that, like made it possible for them to maybe have a child in the future?
So if they had had an oncologist or someone in their medical sphere say to them, before you have chemo, consider that chemo can kill your eggs. So there are two things we can do about that. We can put your entire reproductive system to sleep during chemo using certain medications, and that may help to protect your reproductive system. Or we can harvest some of your eggs or embryos now so you can use them later.
Perfect. Yeah, that's that. I just wanted to clarify that for the students.
Exactly. And so, that piece of information, if the patient doesn't get that information, it's over.
Yeah.
It's not something you can go back on. And so there are all of these decisions that we make in that those very hectic first weeks when we're diagnosed that have really serious long-term repercussions. And we need to just make sure everybody knows what the horizon is here, what the options are, and how one decision affects another one. And so I realized that I had had great care. So I was sent to think about fertility before I started chemo. I was sent to specialists to help me think through the different elements and repercussions of all the treatments that I was to undergo. But many, many patients don't have that. And so we needed a place where patients could go, where they could learn about all of this and understand what decision leads to another decision, leads to another decision. And once you make one decision, what falls away, what works, what doesn't.
And that is essentially what Be the Choice ended up becoming, right? This place of understanding the options, decision trees, and providing that empowerment of information.
Exactly.
So
exactly.
Tell me more about what Be the Choice has become and what it's done for people.
So a bunch of us, some of us were still in treatment. Some of us had been out of treatment, other volunteers. My entire first year law class came on board, and everybody. It's really important in terms of advocacy. Get your peoples together and form groups. And our doctors, most importantly, as well, right? So we all got together and we said, okay, how can we do this better? How can we help doctors to, encounter patients who are empowered with the right information, right? Not dis or misinformation, but the right information, so that they can have a more productive conversation in the limited time that you have with a doctor. How can we make sure that patients understand the horizon of options and which options lead to others? How can we make sure that every patient understands what is at risk, essentially, in the decisions that they're making? And so we decided to create what we call the decision trees. And so they look like abstract trees, but the reason that we used the tree concept is because in starting the decision-making journey, you can literally see which branches your decisions fall into. And what we wanted to do was make them very easy to look at visually, And then every time a patient chooses a decision, the other decisions fall away from their decision-making trajectory and path, so that patients can understand, okay, if I choose to do this now, then this option falls away, but I have all of these options. If I choose to do this, these options then, are viable, but these options are not. So we wanted to teach them about the decisions that would be coming up if they make choices early on. Then we also wanted to make sure that it was easy to understand, right? So we did a lot of what they call in the field knowledge translation work, but what's really making something very complicated easy to understand. That's what we did. And so we wanted to be at about a grade 8 reading level. I think we're probably at about a grade 10 or 11 reading level. And we wanted to make sure that we had all of the surgical decisions on there. So we're still the only tool on the internet that actually looks at all of the surgical options that are available to breast cancer patients, which frankly is still horrifying to me. It's horrifying to me when we developed it in 2016. It's still horrifying to me, 6 years later, because we still don't have, accurate information out there that links all the decisions together. And then we also brought in a fertility specialist that deals with just cancer patients. And we had them advise us on where we should talk about this, right? And she said to us, as early as possible, right? So we may not know at the surgical stage if the person needs chemotherapy, in which case you don't need to undergo fertility treatments. But if you're diagnosed with a bigger tumor or there's a need for chemotherapy for whatever reason, then you have to stop and say, okay, wait, how old is this patient? What are their dreams? What do they wish for their future? And at that point, that's when that intervention should come in. So that's what we did. So at every stage and with every different component of this process, we brought in that information. So that's the overall goal. And I think innovation actually that we offer at Be the Choice.
It's just so inspiring to hear how you took your own personal journey, realized what the problems were, and then created the tool that would have helped you for future patients. So I just want to commend you. It's just amazing to hear. I've heard it many times, but every time it's just inspiring.
Oh, thank you so much. Thank you.
So I want to draw us a bit outward now and just talk about cancer a bit more generally. Many of us, of course, will be diagnosed with cancer in our lifetime, and likely all of us have been affected by cancer or will be once someone close to us is diagnosed. So do you have any general advice for when someone first receives this diagnosis or when we're supporting someone else? Just because I think this is something that many of us will, probably all of us will experience at some point.
Mm-hmm. Yes, unfortunately, you're right. So here's my biggest advice. If you have someone, a friend who's diagnosed with cancer generally, but breast cancer as well, be there with them. Be there in the moment. And I don't mean that in some frivolous, kind of way. I mean, actually, literally accompany them. And I had quite a few friends who were very close, very good friends, who were so terrified to say the wrong thing to me that they actually said nothing to me. And they ignored me. And then the longer they ignored me, the more they wanted to ignore me, right? Because then they were ashamed they were ignoring me, right? I mean, it was this horrible cycle. Yeah. And all we really need, I think, as a society to realize is that bad things happen. Bad things happen. And we can't control some of these things. And if you have a friend or a family member who's diagnosed, it's okay to recognize that bad things happen. And so the appropriate response, right? If you have nothing else to say or don't know what to say, is, I'm so sorry this has happened and I am here. That's it. That's all you need to say. And I am here. And then go on and think about what are the things that this person really loves? And just start doing them. Like, don't be asked. Don't ask, don't wait for a phone call. Don't wait for a text message, because that always puts the onus on the patient to reach out to their friends, right? And family members to say, I need this, or I need this. And sometimes that's really hard, especially when you're trying to navigate all of this other stuff going on with your health and your own worries and anxieties. So just do, be there and do, and don't step out. You know, I think that of anything that I wish now that I could say to some of those friends who just found it so hard would be that, right? Just come over. Just be. Just sit and watch a movie with me. Just tell me about the gossip in your life. Just, right? And just treat me not as being breast cancer, but as having breast cancer. And so, there are lots of times when I didn't want to talk about bloody breast cancer again, right? But I just wanted to talk about what was going on in the world. And I wanted to talk about what my friends were doing and all the exciting things happening in their lives and all of those kinds of things. So don't ignore, engage, and engage from your own kind of volition and ideas that you have about what they love. So that's the first thing I would say. And what was the second part of your question?
I think that was the main question.
Okay.
Either if you yourself, I guess this other part was, is there something you wish you had known as someone receiving that diagnosis, for someone who might receive it in the future? Just any kind of pearl of wisdom.
Yeah. There. So if you're diagnosed yourself, that was the second part. Thank you. Yeah. So listen, it's a moment that is very, very difficult. And it's really important, I think, to do two things. Well, to breathe, first of all. But secondly, to remember that breast cancer is a very survivable disease. Yeah. So, right. I think a lot of people have the idea that, most people with breast cancer die, right? That it's a death sentence, that, but actually, especially if caught early, and this is why screening is so important, breast cancer is a very, very survivable disease. Okay. So that's number one. But number two is, when you're imagining the treatment path, it's hard to figure out what that is going to look like for you. And nobody can really predict it, because, the only way we really have to tell what the next treatments are is when we actually do the first treatment, which is typically surgery, although it might be chemotherapy. So, but no matter the treatments, when I look back, I remember all of the anxieties around, what is this going to do to my body? Am I going to be able to surf? Am I going to be able to teach? How's this going to affect my life? That you can live a really good life post-treatment. And it does affect your body, and it does affect your capacity to do certain things. But we're very good at figuring out how to, one, adapt to those, and then how to push through them as well, if need be.
Thank you. I think that's such important life advice, and it might not be the policy-oriented question that I'll get to next, but I just think it's so important to hear those words, since it's something so many of us will experience. So thanks for taking the time. Really, really great advice there. Now I want to pivot back to the policy piece. So in an article that I include in this lesson and that you sent to me originally, it mentioned that fewer women would be diagnosed with late stage breast cancer if they were screened earlier, particularly in their 40s. But we know that screening is seldom happening, and even for most, not before they turn 50. Why do you think this is going on? If we can prevent needless suffering and deaths, why are we not doing that as a society? And what can we do about it?
Okay. This is why courses like your course here and the other teaching that you do, this is why so, so, so important. Policy, people who set policy in this country need to understand their subject matter. And so I'm delighted that I'm here and I have this opportunity. So this whole scenario is a disaster. That's what's going on here. So the government decided to put this panel together, and they said, it's going to be about screening. Let's figure out when to screen and, etc. So you'd figure, I'm going to have my 5 top screening doctors here on this panel, and we're going to figure out what a good approach to this is going to entail. Well, that's actually not what the government did, right? So they put all kinds of pseudo specialists and specialists on this panel, but who are not dealing with screening. So they don't know what the newest research is. They don't know where the sociological trajectories are in terms of health and well-being in our society. And so they are making decisions for all of us that are wrong, that are bad, that are misguided. They're not scientifically founded. And this isn't being changed because policy changes take a long time. Now, and it's actually shocking when you read who's on that panel and how long they've been on that panel and served, and how little regard there is for this really, really vital issue. So and so I'm working with an organization actually called Dense Breasts Canada, and you should look them up because it's really important to know your breast density. And because this organization is fantastic work, and they're really they're leading actually change makers and advocacy folk that are working on this issue. And so Be the Choices, and I personally am partnering with them to have them heard. We need screening people on this panel because we need to change this policy, and then that policy needs to filter down to every family doctor, every primary healthcare person that patients are going to encounter. And so that, like my doctor, who just happened to be a very careful individual, right, can actually say, I'm going to ask, and I'm going to make this a policy within my own practice that this happens, right? And we have guidelines for all kinds of things, bowel cancer and this, and right? So what we need to do is lower the age for screening for breast cancer. And that has been proven, but is not being done.
And I think what this speaks to is not only the importance of policy in terms of screening age, but also access to primary care. So many people don't have a primary care practitioner, whether that be a family doctor or a nurse practitioner, to help guide them through any preventative screening, right?
That's
They're
right.
only going to emergent care when an emergency arises. And by then it could be too late. And I feel like it's no exaggeration to say that your family doctor may have saved your life.
Absolutely. And I tell her that every time I see her. And she gets a lot of cookies from me too. So no, but absolutely. Yeah, here's I mean, post-pandemic is another, there are lots of things that are coming up post-pandemic in terms of our healthcare system. And I think some of those are discrete issues caused by the pandemic, but we have a primary health care crisis in this country. Every single citizen needs a doctor, a family doctor. Why? Because they know you. They know your life, your environment, what you do, what you value, where you come from, hopefully, right? All of these things. And they can say to you at 40, you should have a screening for breast cancer. You should, and we need those people. We need those people. And, in our entire healthcare system, I think they're one of the most undervalued frontline caretakers that we have, frankly.
No argument here. And you touched on this a little bit, but it sounds like what was already a really difficult situation has gotten worse with the pandemic, right? We've heard about how screening and treatment programs have been delayed for many cancer patients as well as other conditions. Any thoughts on that or anything you've observed?
Yeah. So I really worry about this because I think we're going to see, in terms of our mortality rate, we're going to see a huge upswing because patients have not been diagnosed. Patients haven't even been seen, frankly. And add to that, of course, kind of the primary healthcare, crisis that we have going on. So absolutely, we will see that. I worry about that, and I say to anyone that is thinking about or worried about that in terms of their own healthcare, go and see a doctor. We do have a right in this country to see specialists. And so if it's through an emergency department or through another way, if you don't have a doctor, do it and insist on it and be your own advocate. That's really important.
Well, thank you so much. Those were my primary questions for you. Is there anything that you wanted to mention and didn't have a chance to?
I think if I may say two things.
You may.
One, I know, I can't help myself. So one, I would just encourage all of the students who are listening to this, who are interested in policy, and who may be interested in advocacy. One, just make sure to always be your own advocate first, right? And that is, and it's not just in a healthcare crisis, right? It's also with your professors, with your, employer, with your, and be your own advocate. Say, actually, I'd like to discuss this issue with you if I could, right? And so I think that's really important in terms of advocacy. But then in addition to that, be an ally to someone that needs an advocate. Studies show that when you're in a health crisis, you remember about 8 or 9% of what a doctor tells you, right? And you come out and you literally have you remember 2 things, but they've told you 25. So you need to have someone there with you. So if it's breast cancer or another type of health crisis or other type of crisis that we face in our lives, try to be an ally with someone who's going through something like that. And then on a bigger scale, think of policy work as advocacy work, right? Policy is important standard setting in our society, but policies more often than not, need to be reviewed, need to be critiqued, and need to be changed to meet the needs of what we're actually facing on the ground. So policy workers, in my mind, should be directly connected to the people who are facing whatever it is, the area that you're working in terms of policy, right? So it's not just about like hearing circles and listening tours and whatever else. Actually, the policy folk at the junior and senior level should be talking to people who are going through whatever policy they're thinking about. Average people, ordinary people, normal people, right? That are facing that, so that the information that you have is relevant to how you're thinking about changing that policy that you're working on.
Oh, again, amazing advice for health policy students, and something I hope that you'll all carry with you throughout the rest of your time in this course and throughout the rest of your careers and lives. Dr. Adrian, what a pleasure it's been. I know you've won teaching awards, and I can see why you're so articulate and passionate, but the work you've done in your life has been just amazing, and you deserve every accolade you've received. And we're really lucky to have had you join us today. Thank you.
Oh, that's so kind. Thank you, Dr. McLaughlin, for inviting me. It's been such a pleasure to be here with you. Thank you.